How to survive a heart attack alone after 60. 8 life-saving tips every senior must know. Let's talk real for a second. By the time you finish listening to this introduction, about a dozen seniors will suffer a heart attack, and nearly half of them will be completely alone. No caregiver, no helpful stranger, just them, a failing heart, and a ticking clock. I'm Dr. Z. After more than 20 years in the trenches of medicine, one phrase still echoes in my mind. I didn't know what to do. And that's not just heartbreaking. It's preventable. Because here's the unfiltered reality. 65% of people over 60 who die from heart attacks never make it to the hospital. Not because help wasn't available, but because they waited, they panicked, or they simply didn't know the signs. That needs to change. Today, I'm breaking down 8 critical steps that can literally save your life if you experience a heart attack while alone. These aren't theories. They're real-world battle-tested tactics. The same ones that helped Richard, one of my favorite patients, survive a full-blown widowmaker. So if you're over 60 or love someone who is, pay close attention. What you learn today could be the reason you, or someone you care about, survives tomorrow. Step 1. Know the real signs. Spoiler. It's not the chest-clutching Hollywood drama. Let's bust a deadly myth right away. The movie version of a heart attack, gasping, chest-grabbing, collapsing, that's not how it usually plays out for seniors. According to the American Heart Association, 40% of seniors who suffer a heart attack feel no chest pain at all. No pain, no drama, just off. Take Joyce, one of my sharpest 83-year-old patients. Her only symptoms? A wave of fatigue and a touch of dizziness. That's it. No pressure, no pain, just a subtle feeling something wasn't right. Her neighbor called 911, and that saved her life. Here's what you need to look for. Sudden, unexplained exhaustion, shortness of breath. Even during simple tasks like folding laundry. Cold sweat that's unrelated to weather or hormones. Indigestion, nausea, or upper belly discomfort. Dizziness, foggy thinking, or lightheadedness. Vague discomfort in your jaw, back, neck, or arms. Sleep disruption or extreme fatigue in the days before. These are called stealth symptoms, and they're especially common in women over 60. If your body is sending weird signals, listen. Don't wait for chest pain. Step 2, call 911. Not your spouse, not your son, not your Uber driver. When something feels wrong, your first instinct might be to call your spouse or try to handle it yourself. Don't. Call 911 immediately. Why? Driving yourself adds dangerous cardiac stress. You could lose consciousness mid-drive. Paramedics start treatment the moment they arrive. They're a rolling emergency room. Take Anthony, 76. Fiercely independent. He felt chest pressure and decided to drive himself. He blacked out at a red light and crashed. He survived, but now calls his car the mobile mistake. Here's your emergency script. Sit or lie down safely. Call 911 and say, "I think I'm having a heart attack." Unlock your front door. Paramedics aren't action movie characters. Use your medical alert button. If you have one, don't wait. Don't drive. Don't tough it out. Call the pros. Step 3. Take aspirin, but chew it like your life depends on it, because it might. Aspirin won't fix a blockage, but it slows clot formation and buys your heart time. How to do it right. Take 325 milligrams, 1 adult or 4 baby aspirin. Chew it. Don't swallow whole. Take a tiny sip of water if needed. Tell EMTs exactly what you took and when. Pro tips. Don't use Tylenol or Advil, they won't help. Skip aspirin if you're allergic or on strong blood thinners. Keep aspirin in your nightstand, purse, kitchen, anywhere you might collapse. It's not a cure, but it's a life-saving buffer until help arrives. Step 4. Sit like a survivor, not like a soap opera corpse. TV shows love showing heart attack victims lying flat. That's bad advice. Use the high Fowler's position. Sit upright with back support. Recline slightly if you're dizzy. Bend or extend your knees as needed. Lean left if you're nauseous. Why it helps: maximizes lung capacity, reduces heart strain, makes you easier to treat, helps you stay conscious. Also, loosen tight clothing, belts, shirts, Spanx. Cover up if you're cold. Shivering stresses the heart. Stay near the door if possible. Don't walk. Don't climb stairs. Don't push through. Just sit and breathe. Step 5. Hack your nervous system with 4-7-8 breathing. When your heart panics, your brain follows. That's where 4-7-8 breathing can help. Here's how. Sit upright. Place your tongue behind your front teeth. Exhale completely with a whoosh. Inhale through your nose for 4 seconds. Hold for 7 seconds. Exhale slowly for 8 seconds. Repeat 4 times or until EMS arrives. Even if you can't get the timing perfect, try. This activates your parasympathetic nervous system, your body's calming switch. Benefits: slows heart rate, lowers blood pressure, increases oxygen efficiency, keeps your brain focused and out of panic. Vivian, 71, swears it saved her. I needed something to focus on besides dying, she told me. And science backs her up. This isn't yoga fluff. It works. Step 6. DIY chest compressions, aka cardio MacGyver mode. If you're alone, blacking out, and help hasn't arrived yet, this is the last resort. Try self-compressions. Lie on a hard floor, not a bed. Make a fist and place it at the center of your chest. Use your other hand to push that fist down hard, then release. Repeat 100 times per minute. Hum, staying alive for rhythm. Warning, you might crack a rib. It's not as effective as real CPR. Only do this if you're on the verge of losing consciousness. It's not pretty, but it might buy you the extra 60 seconds that save your life. Step 7. Have a heart attack plan before you need one. In a real emergency, your brain won't be at full capacity, so you need a plan before it happens. Build a system. Create a medical info card with your name, age, meds, allergies, doctor. Keep chewable aspirin in multiple spots. Program icy contacts into your phone. Set up your phone's medical ID. Consider a medical alert device. Make sure your house number is visible. Know exactly where to sit, where the aspirin is, how to unlock the door. Share your plan with family, neighbors, even your barista. Ask your doctor about nitroglycerin. Louise, 79, had a plan. She followed it step by step and survived a massive heart attack alone. No panic, just action. That's how you beat the odds. Step 8. Richard's story. This is why we prepare. Let's talk about Richard, 72, retired teacher, widower, a gardening wizard. One afternoon, he felt strange, tired, with some pressure in his upper back. No pain, just a weird sense something was wrong. But he didn't ignore it. He sat down, took an aspirin, focused on his breath, called 911. The gate was already unlocked, just like he'd planned. The diagnosis? A widowmaker, a 95% blockage in the LAD artery, the kind that kills fast. But Richard survived. Walked out of hospital a few days later. 6 months later, he was back planting tomatoes. He told me, if I hadn't known the signs, I'd have laid down to rest. I might not have gotten back up. Final thoughts. Be ready. Stay alive. Let's recap the battle plan. Know the stealthy symptoms. Call 911 first and fast. Chew aspirin immediately. Sit upright and stay calm. Use 4-7-8 breathing. Try self-compressions only if you're out of options. Build a plan and practice it. Share it with someone who will remember, because in a life or death moment, you won't rise to the occasion. You'll fall to your level of preparation. So be prepared. Like this video if it helped. Share it with someone over 60. It could literally save their life. Got a story or a scare of your own? Drop in the comments. I read every single one. Until next time, I'm Dr. Z, reminding you, you have more power than you think, especially when it counts.